All right. So as people come in, we're gonna go ahead and get started. We want to make sure we maximize our time,
Sure.
maximize the energy. Just to give everybody a little bit of context, my name is Omari Maynard. What you see in front of you, the gentlemen you see in front of you are part of the Luxor Collective. We are the Luxor Collective. The Luxor Collective came about from and through the passing of Shamani Gibson, my life partner. She passed away 13 days after giving birth to our son, Kari. And, through that experience, it was a very heavy experience for me. And, in the process of learning about maternal health, in my mind, I knew there was a collective of men who were getting together and galvanizing to try to redirect birthing outcomes and create space for, men to have a space to, lean on each other, but also to help redirect birthing outcomes for their partners, and their family. But I quickly found out that there was no specific space that was like that. So ended up creating it. And, this was, I want to say about 3 years now, 2 years in the making. So, and this, right now, these men that you see before you today are a huge, 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 huge part of Luxor, and just really looking forward to having this conversation out in the open, so that you can get a taste of what we do, how we do it, the reasons why we do this, and of course, the importance of art in this whole uh, conglomerate, So just even with that, thank you so much. Women's Art Caucus of DC, thank you for creating this space for us. Thank you for allowing us to share. Thank you for allowing me to exhibit and say hi, Kari. And as we learn and grow together, it's super important that we have our babies learning and growing with us, so that they can
Sure.
carry the torch. With that said, I want to introduce you first to how we open up every Luxor meeting. So every Luxor meeting, we open it up with face rights. And I'll pass it on to you, Dre, if you don't mind, just so I'm not just heavy talking, talking, talking. If you feel like explaining
Mission.
what face rights is, that'll be
Let's
awesome.
start with permission first.
Okay, awesome. So with face rights, we always ask and begin with permission to begin from the eldest in the room. And we want to do that because, of course, we want to honor our elders. One, we want to make sure that, we acknowledge their importance, not just in their age, but in their wisdom, most importantly. So with that said, is there any elders in the space who are 70 and above? Anyone 70 and above? All right, we got Baba J and we got Cynthia. Awesome.
It's Sarah.
Cynthia and Sarah. And Sarah. All right, so 75 and above? 75 and above. Okay, okay, it's a close race now. All right. Oh, Renee, you 75 and above? All right, awesome. All right, Renee. So Renee, do we have permission to begin? Thank you. Thank you, Renee. Much
Please do.
thank you. Thank you. All right. So Dre, I will pass it to you to explain the face rights and then we'll get into it.
Sure. So, hello, everyone. Thank you again for having us this afternoon. My name is Andre Nelson. I got into the real briefly. I got into the maternal health space as an analyst in healthcare. So I started my career in health as a revenue cycle analyst, but always looking at healthcare disparities. And I think what threw me off the most is understanding that maternal mortality rates were so high in preventability. So if we're talking out of 10 women that pass away, 8 of them could have been prevented. And I think for me, it just sounded absurd. So I kind of walked the path of trying to do something. Although this wasn't a part of my job, I tried to do something about it and ended up meeting Amari. So we can get into that a little bit later, but quick introduction. So with Face Rights, what we do when we open up every morning with the men that we meet with every other Thursday, we do something called Face Rights, and it's a basic brief introduction. Usually it's name, age, location, and maybe one thing that was positive in your day today. Omari, did we have a specific Face Rights for today?
Yes, thank you for asking, Dre. So today's Face Rights, what we'll do is talk about our connection to maternal health. Mhm.
So why don't we do name, location, and our connection to maternal health? Okay. So my name is Andre Nelson. Like I said before, I'm 41 years old. I live in Fairfield, Connecticut. And my connection to maternal health is, I call myself the analytical advocate. I don't do like protests, or I'm not an artist. What I do is numbers and data, and I like to tell stories with that data. And the stories should help inform folks how to move, things to do to help the situation. So that's kind of my strength. I'm a data nerd and proud of it. I will pass it to Baba J.
Um, Thank you, young man. Thank you. Appreciate that very much. Baba J, Dr. Onaji Weed, 72. I live in a small town called Lansdowne, which is near Philadelphia. Most of my work is done in a small town called Chester, Pennsylvania. And I'm a fatherhood coordinator for the Foundation for Delaware County. And that means that I'm working with what is called Healthy Start. And we work with couples who are expecting up until the age of 18 months for Healthy Start and 24 months for Nurse Family Partnership. So that's what I do professionally, but the whole idea of having a safe birth and having the mother to survive after the birth is just a human concern. And certainly that concern is very much concentrated in the Black community, given the statistics. And as it was earlier said, CDC said that out of all those deaths, 86% in fact were preventable. And of course, what is also strikingly so difficult to comprehend is that most of those deaths happen after the birth of the baby. So we're talking about within the first year, so much so, as you probably already know, that discussions um, around the fourth trimester. When every time I say it, it just irks me. The fourth trimester. So that's my connection. I'm a father. I'm a grandfather and an uncle. So it's about living this wonderful life in the Black community. And with that, I'm complete. And I'll pass it on to
Baba J, really quick before you pass it, what I would love to do is have everybody do contribute into the face rights. If you can just enter, I just put in the chat what the face rights is for today. So if you can enter it in the chat while we talk, that'll be amazing. So we can get some more insight about, everybody who's here. And you could pass it to Dr. B, Baba J.
Thank you so very much. And I'm passing it on to Dr. B.
Love and respect, Babo. So I'm Dr. B, aka Baba Atum. I'm the son of Nancy and Steve Batiste. I am a grandson, a brother. I have accepted the role and responsibility of being a father, first through becoming an uncle to my sister's daughters, who really inspired me to navigate the journey of becoming a man with some serious thought. I have come to this space, and I'm in my fourth decade now. I'm in Tallahassee, Florida. Shout out to Mama Yada, who's in this space. I love Melanin Mothers Meet. I'm also on the advisory board for Melanin Mothers Meet. I've served in the peace, sister. Thank you for joining us. I've served as well as the statewide coordinator for the Florida Maternal Mental Health Collaborative for about 4 years. Transitioned from there, started an entrepreneurial role in Balance and Being, which is a consulting agency that this past year I collaborated with Ms. Jenny Joseph, who was Time Woman of the Year in 2022, who in a phenomenal woman, who is a midwife in the Central Florida area and internationally renowned for the work that she does through Common Sense Childbirth. We collaborated on a grant with Healthy Start at Flagler for Lucia County and the Department of Health to introduce a pilot program that was for telehealth and telesupports. And so through that program, we're able to show what it is that actually is seen as valuable to mothers whom are in the perinatal space, whom are pregnant or postpartum, what they request, right? And what they need, and truly coming from a position of service and being servant leaders, as opposed to telling them, hey, this is what we got for you and either accept it or not. We wanted to inquire and give them space to help us help them as best as possible. I am also on the board for the Ariah Foundation, which I'm very thankful for, and you'll get to learn a little bit more about the Ariah Foundation today. We have some amazing programming throughout the year that we'll make sure to share with all of you. But if you are interested at all with respect to arts, reproductive justice, health, maternal health, you need to be involved with what Ariah has going on. I also sit on the board for a Children's Home Society, and that's here in Florida, my branch. I have a vested interest in making sure that families are taken care of, and the direction that CHS is going is in that route, and I'm very thankful to be able to be a part of that. One more board position that I'll mention is near and dear to my heart, because they just, not because of the reason that they named me vice president for the board, but because of what the mission is. And the Florida Association of Infant Mental Health is one that I really appreciate, because we've got to really start thinking about when we address mental health, right? Usually it's after something happens. Usually it's when we're in our adulthood, but we should absolutely be considering the environments that we put our children into, that we bring them into. And that's part of the work that we're doing here today, and why we know it's so important for men to be a part of the movement and be invested into maternal health, because we know that when children have full environments, when they have full relationships, experiences socially with healthy men and women in their lives, they are able to develop at a very different pace, rate, and reach their maximum potential in ways that we all could just dream to imagine. So we're here trying our best to activate the divinity within all of our children by just being present as fathers. And I'll go ahead and pass it on to Baba Omari.
Thank you, Dr. B. And my name is Omari Maynard. I'm 43 years old. Hail from Brooklyn, New York, Bed-Stuy to be specific. I am the co-founder of the Ariah Foundation, and Ariah stands for the Advancement of Reproductive Innovation through Artistry and Healing. Like I shared with you, I have lived experience in maternal mortality epidemic that's happening in the United States, so what Ariah does is to make sure that we use art and artistic modalities to have these type of conversations, and open up doors to have conversations around maternal health, maternal mortality, reproductive justice, healthcare inequities, but more importantly, creating these spaces so that we can figure out ways to redirect these outcomes and redirect the positioning that specifically Black and Brown people hold in systemic racism in all levels of it. So and for me, art is a huge piece of that. Thankfully, I come from a family of artists. I was able to find my positioning in art and with my partner Shamani, but after she transitioned, it was really about how with the lessons that were taught by her, as well as my family, how do I hone, art and in its totality, so that I can, speak in a way that's revolutionary, so that I can create a space that, is not just productive and purposeful, but, allows me to always praise Shamani, and then also the thousands of Shamanis that honestly have transitioned due to the maternal health crisis. And through that, I was able to meet these beautiful men. As you can see, in the maternal health space, you really find a group of men that are having these type of deep conversations, not just around maternal health, but um, the importance of healthcare, and then also to the importance of men being in the space to support, not just support their partners, but to support each other. And I think that that's really a huge piece of Luxor, really aligning ourselves with men who are not just thought leaders in this space, but also have a vast understanding of the fact that they don't know everything,
Gotcha.
that they're lifelong learners, and that, we need each other to make sure that, we can build and grow as a family, and community. So with that said, I want to introduce and start with the Art, Healing, and Reproductive Justice exhibit that Cynthia and Prudence put together, which was an amazing exhibit. And I'm going to come to DC to make sure that I see it. If you have not seen this exhibit yet, it is at Artists and Makers in Rockville, Maryland. The exhibit opened on March 7th, and it'll be closing March 26th. So please, please, please make sure that you go and check that out. There's 21 amazing artists who have been a part of or who are part of this exhibit, and from what I heard, the opening night was a smashing, smashing success. And I'm more than positive that, when I'm able to get there myself and put my eyes on all the work of all the artists, I'll be touched and moved. So it's really excited about that. And before we got on, Cynthia was talking about, the reason why she wanted to put this exhibit on is because of the fact that, the maternal health crisis, it wasn't something that she really necessarily knew about or heard about, but I want to bring that up because, when we talk about all things maternal health, not just maternal mortality or maternal morbidity, but stillbirths, miscarriages, releasing pregnancies, things of that nature. These are things that happen to, women, not just women or birthing partners, but also men have this experience so often. And it's often a space that we don't get to have conversations and really talk about, so I'm just so thankful that, Cynthia had the peace of mind to open up the floor to using art as a conduit to create more conversations around this, So before we get into the question, and then I'll ask the gentleman to chime in. I see you got your hand up, Baba J. You can go ahead
Oh,
and
yeah,
take it.
thank you. I just like to contextualize the talk, and that is one, all of this is taking place in what is called the Ma'afa. For those of you who haven't heard that word, it's a Kiswahili word that means the terrible occurrence, that speaks to the kidnap, the transport, enslavement, and the terrorization of Black people, African people here in the Western Hemisphere. So we are talking about healing from the Ma'afa, and this is just one aspect of it. It's everything, our whole life space, in fact, is contained within the Ma'afa. And we use the word Sankofa, which means to go back and fetch it from Ghana. And now when we look at artwork, right, we can reference what is called the Black Arts Movement, which is usually considered 1965 to 1975. It was a cultural movement that emerged around the same time as the Black Power movement, and through art, through literature, through dance, through theater, it gave Black people identity, purpose, direction, and a sense of joy. So I just want to contextualize that in the larger space of people who've been colonized, and this is our way of liberation and healing ourselves. Something, son.
Gotcha.
Thank you for that, Baba J. I want to stay with you too. I want you to expound upon that. And I'm gonna put the question in the chat as well. But I want you to just share with the community why you think it's important for men to be active in this maternal health space as advocates, especially since amongst us you've been in this space the longest, and then and have the most depth of knowledge. So I want to ask you that, and then also too. The importance of connecting it to art, as us being artistic people just by nature.
Yes. Well, I mean, I guess, we begin with the type of Eurocentric socialization that we have come through. And I'll go back to the Ma'afa. Many Black families do, in fact, engage in abusive discipline, but that comes out of slavery that has been uninterrupted, because at the time we had the mothers and the fathers had to grab that child and make her know that they couldn't say what they were saying, they couldn't do what they were doing, because it would lead to any kind of problem, the killing of the child, the selling off of the father. So that's been passed down, it's been uninterrupted. So we do see, so what happens is that in current day cultural, not even cultural norms, but induced culture, we tell the boy, don't cry. My father told me that, don't cry. And then when I fell and started to cry, he says, far from your heart, you ain't gonna die. So we are dehumanized in our very early stages of our development. Boys don't cry. Now, when you take that elongated, then that can lead to domestic violence, right? That can lead to the violence that we see in our community. So when we say men have to be involved with this movement, it gives us a chance to be humanized again, so we can be in touch with our emotions. We can be in touch with the oxycontin when we are fathers and we start to feel more compassionate, right? It's nature's way of saying this is how you need to be more compassionate right now. This is we need the ultimate amount of compassion as you're becoming a father. So to have been involved in our movement is in fact giving us that place where we can talk about these things and talk about the hurts that we have experienced as boys, as teenagers, even as men. So critical to include art because art most often relates to the right side of the brain, and it gives us the ability to create, right? To be creative. So it's the opposite of oppression because creativity is saying that there's a space of possibility, is a space of joy, and it's a space of beauty. So art is so very important.
Yeah, bro.
So,
I
That's
love that,
powerful.
Barbara J. Thank you for that, man. It is important. And you know what, Dre? So this is for you, Dre. Same question, but you started off as saying you were not an artist, you're a analyst. And in my brain, like analyzing data, like that is an art. It's an art form, especially when you're able to take numbers and create stories behind these numbers. So with that said, I pose the same question to you, and how you've seen the effects of the work that you've done over the last 4 years in this maternal health and art space.
Yeah. So first of all, thank you for bringing that up because what I did say is a lie. Like there is an artistry behind the stuff that I do. So I take that all back. Everybody in the space. So let me come from a data perspective first. Why men or fathers are important to the maternal in the maternal health space, right? So fatherhood involvement has a positive impact on not only mom and baby, but overall for the family. So we're talking about reduced stress and depression for mom, reduced anxiety and postpartum depression if men are educated or fathers are educated in how to show up in the space. Lower risk of preterm birth and low birth weight. And everything I'm saying is evidence based, right? So that's really important to know because there are a lot of barriers for fathers in the space, whether it's folks in the healthcare space that don't understand the value of fathers being there, or even fathers thinking to themselves, like, I don't know what I'm doing, I don't know how to show up. When we have data that says you make a difference, not only to mom's health, but also to baby's health, that's really important. And I think this needs to be a part of like every conversation, this evidence-based data that says that you are important. For infant health, we have lower infant mortality rates, higher breastfeeding rates when men are educated on how to help, and improved cognitive and emotional development. And so these things are important. And I think this is why I advocate in the space so much, especially for fathers, is that they make a difference. When it comes to the art and what I've seen in the last 4 years, I think again, being able to take some of this data, I've created impact reports for the Ariah Foundation. I'm creating one now for Luxor. Um, for me, social impact is huge. And I think no matter what the cause is or no matter what we're doing, looking at the numbers, looking at how many people we've affected, looking at where these people are from, like I created a map looking at where all the folks from Luxor are tuning in from, and it's all over the country, and so that's important because even one individual in Wyoming that knows what's going on with this, with this maternal health crisis, with the importance of fatherhood, they can make a difference in that community, and that's how things spread. So to be able to tell a story, to be able to show a story, I think most people are visual learners. So if they see a graph versus seeing an Excel document that has a bunch of numbers, the graph is going to be ingested, digested, I think, more readily than looking at just a spreadsheet with numbers on it. So I think that's where the creativity comes in for me. It's like, how do I make this information interesting? How do I make it visually appealing? And tell a story with it so that people can, we all remember stories. We don't necessarily remember data. Luckily and thankfully, Omari, the Ariah Foundation, like they've created a space for me in which I can come in and shine with the skills and gifts that I have and not have to feel like I need to paint like Omari or play the drums like Baba J. That's kind of my space, and I've been able to hone my skills in this space and super grateful for it. And I'm complete. Hopefully that answers the questions, right?
Most definitely, definitely. It gives everybody more insight on why it's so important that you're here, and the data and information behind the numbers. You said something really interesting just in terms of showing up as your, be able to show up as your authentic self and, being able to lean on others' wisdom and knowledge and expertise and then use that to build, for yourself, and I think of when you say that, I think of, Dr. B, like just in terms of, you know, myself in this space, being able to use art as a way to tell stories and be a narrative strategist around um, telling stories of women who've transitioned. A lot of that for me comes from being a teacher. I used to teach. I taught all grade levels, but I used to teach. The last place that I was in was teaching high school. I taught high school for 5 years, geometry and algebra. But being able to sit in front of a classroom and try to get 30 students to listen, forget learn, just listen and be still. It was an art. Being able to transition that now, it just makes me think of the different experiences that we have that now we're able to kind of all come together. So I say that to say, Dr. B, you have a whole bunch of medical expertise. You've understand the nuances of the body way better than any of us do, but also too, just from, I mean, your resume says it yourself, you sit on like 5 different boards, and have a vast experience around reproductive justice, maternal health, and family wellness. So why is it important to take that information the book knowledge that you have, also with the lived experiences that you've gained, throughout from these different entities that you're a part of, and then bringing it to Luxor and art, like what, I guess more than a question is like, what has it taught you? How can you provide us just insight about just the dopeness that you provide and are?
Respect, brother. I think first off, I give thanks to the Most High for consciousness, for this breath. When I think about all the information that I've acquired over my years in academia as well as through life, I realize that that information is completely useless if I cannot apply it or share that information for it to be applied. So it's critically important to learn how to share information as well as collaborate around information. And I think that art is the best way to allow for information to be expressed in its fullness, right? As Baba J said, art is creative. And so it's not to be rigidly following a certain structure, although we know that when you implement protocol and you put a recipe together, you can get a particular outcome. So it's important to recognize that you can follow a structured pattern, but when you are fully expressing yourself and allowed to express yourself, there is a great healing that happens within that space. And for, we're talking about men folk, I think our experience as the sons, the brothers, the fathers, to the women whom are experiencing this crisis of dying, right? Increased mortality, morbidity, having adverse outcomes at a greater rate and cause that, as Brother Dre said, are most of the time preventable, right? We are the menfolk that are in closest proximity to these women. So internally, whether we consciously think about it or not, we are feeling some type of way about that, right? What am I doing and or not doing that leads to this result in outcome? And that puts a great onus on us and a responsibility that it it is important for us to recognize our true role, which earlier was already stated is safety. I think that the most important role that men can bring into any space is to ensure that safety is present. Stability in the form of emotional, mental, physical, spiritual safety, reducing the level of stress for especially mothers, but for all members of the family and for anybody who's involved with a pregnancy and or rearing a child. We can set tones that allow for joy to exist, allow for nurturing and caring to exist, and we have to break and rewrite the script on what we've been taught and told manhood is or what it means to be masculine. I feel like too much, and we all know this. There's this term though that I'm not really even fond of because it's toxic masculinity. No, true masculinity could never be toxic, right? So that's some other thing that we're talking about when we're referring to toxic masculinity of men that are overbearing or men that are chauvinistic, etc. We as menfolk that accept the responsibility of matriculating to becoming fathers, because I think that the step in manhood is fatherhood, right? When you're moving forward, whether you're fathering biological children or not, when you accept the responsibility to be an example, be a father to your own children or children that are within proximity to you, to just be an exemplary man, is to be a father. You are now setting the tone for those that are around you that understand, oh, there's a certain character that I have to come with and to exist around this man. There's a certain way that I have to speak, carry, hold myself when I'm around this man, or else there are some consequences to that, or there will be a reaction to that. For us, right, when we're looking at how to meld together the information, the art, how to change the narrative, I think it's crucial that menfolk understand their roles to accept responsibility as partners, as fathers, as men in the space, as caregivers and nurturers, as advocates, as the brother Andre said, with the data advocate, analytical advocate, and these things can lend towards ensuring better outcomes for maternal health. But if we don't start off with safety first, it's all for nothing. I think one of the greatest issues that we have for our mothers is that they're stressed out, whether they're saying it overtly or they're experiencing it subconsciously. They're stressed out. Who wants to bring a child into this world? If you really think about shout out to Kari, if you really think about what's happening in the world, it's a dangerous place. It doesn't feel safe overall. We have to create those elements of safety for there to be that, for safety to exist. And so now I wanted to really just emphasize that all of the information and all of my experience, after I put it all together and whittle it down, it's about safety and it's about reducing stress, right? There is, those two things will bring us the outcomes that we're looking for. And I know that we can access that within us. And what is such a great way that we can do it is through art. art can be extremely relaxing, right? It can be extremely stress reducing. It can be extremely cathartic too, because when you see that piece of artwork that brings tears to your eyes because finally, what you could not express in words, you were able to visualize and or feel or experience. We can utilize art to level us up through this healing that we have to do. And before I pass it on, I remember, and I wanted to give thanks for Baba J giving the cultural context to this situation, especially for those whom are considered to be Black and Indigenous, because, you know, I've done work in epigenetics, and it is very real. The ability that we have to access our DNA, to change our DNA, and the same ability that we have, others and other things have that same ability. So when you live in toxic environments, again, whether that's mentally, emotionally, physically, or spiritually toxic environments, when you're ingesting trash and garbage, metaphorically speaking, when you're being inundated with images that don't lead to you feeling like a better version of yourself, those things work on you, and they will contribute to a genetic change. They will contribute to your sickness, to you feeling physically ill. The things that you see can lead to a physical illness. The things that you hear about can lead to a physical illness. And the more that we dive into how we structure our environments, right, and truly take agency for where we are, how we are, when we are, that can lead to a more healthy and well family for all of us. So I'm gonna take a moment to breathe, pass it on, but because there's so much going through my mind about what I want to share and what have you, but I just aim to be coherent and as well as concise.
Thank you for that, Dr. B. That was actually going to be my next question, but I think you summed it up beautifully. The question was, how can art challenge traditional notions of masculinity and
Mm,
care? But I mean, even without me asking, you hit the nail on the head. So I think that the next question, for that I'll pose for the community, is just really, well, for the fellas, I should say, is how does Luxor integrate healing practices, right? How do we create and use our space to make sure that we're providing the things that our people who come and engage with us need. It's very important. I'm gonna say, I said the question. I'm gonna just say this really quickly. You know, um, as Andre alluded to, we meet every other Thursday. We meet every other Thursday from 7:30 to 9 p.m. And I know that for myself, when I was going through, my challenges and Dr. B just said it, knowledge and reducing stress levels is how you are able to be your most powerful. And at that time, I didn't have much knowledge about, my feelings and what I was going through with my pain. And, my stress levels were the highest they've ever been in my entire life, trying to figure out how to navigate loss, also while bringing new life into the world, while trying to figure out how I'm going to balance my finances as well as my job, and just knowing that, all these things that once were very, I guess, what's the word I'm looking for? Very, I guess, taken care of in my life. Like I had everything that I needed. I knew that there had to be an entire shift. Like there was no way I was going to be able to keep my job and raise these children at the same time. I had to figure out how to create more income. I had to figure out,
mhm,
create an entirely new community of people that understood what I was going through and could provide support, help, all the things. Um, and that was what Luxor provided me. It provided me with a space of knowing that, regardless of what I was going through on a day-to-day basis, I knew that when Thursday rolled around, I was able to talk to my
mm,
brothers about it. If I even feel like talking to them, I knew that there was a space where I knew that they were going to give me something that I would need without even me saying it. Um, and that, more than anything, just being able to be in a space with, young brothers as well as elders, and having that
Mhm.
intergenerational conversation of just, life experiences, regardless of whether we were talking about maternal health or paternal health specifically, or just being a Black man in America. I knew that, once 9 o'clock, 9:30 rolled around, I was going to get what I needed in order to push me forward, through the next week. And, and being able to do that and have that experience week after week, it really reduced my stress levels and increased my knowledge, and made me have a better understanding of not only who I am, but the direction that I needed to go into. So with all of that said, now I'll pose it to you, brothers. What do you feel and how do you feel like Luxor is able to provide support? You could go ahead, Andre.
Thank you. I raised my hand after you, Dr. B, but
No
Oh, my
pressure.
bad. I got the chat screen
yeah,
up, so I didn't see the hand. My bad. Go
No
ahead, Dr.
pressure.
cool. That's cool. That's cool. So what I often say is like Black men don't have many spaces to converse. It's either the barbershop or the church. And I don't go to either one. So the fact that Luxor is available is a beautiful thing. And I know a lot of other men that feel that same way. When you get into the space, you have to put your sword and your shield down because there's no pride and there's no ego. The intergenerational thing that you mentioned, Omari, is such an important aspect of the space, because we regulate each other, we are able to communicate with each other, um, and really like share life advice and wisdom. And so this space is super special. It doesn't matter how if it's three of us or if there's 20 of us in the space, it makes no difference. Um, the consistency, like you say, Felicia, the consistency of every other Thursday from 7:30 to 9 is sacred. We know that at least one person is going to be in that space to facilitate it. And we'll be able to talk about whatever it is that we want to talk about that Thursday and be free to do so. And I think what Dr. B was mentioning before, when you talk about like the toxic masculinity and how maybe men are perceived, especially Black men, we carry so much with us. I feel like even subconsciously as we walk around, like if we're the only Black person in the white space, we have to be conscious about how loud our voices is. And this goes to maternal health as well. If we need to advocate for our wives, our partners in the hospital, something's not being done, we have to be conscious about how loud we raise our voices and how we have to be aware of our physical presence, because we can get kicked out of the hospital very quickly and then our partners are on their own. So all this is important because when we come into a space like Luxor, we're able to put that stuff down. We don't have to come in on some bravado. Your title means nothing. Your money means nothing. All that stuff means nothing. The space is for us to just be us. And there's not many spaces like that. And not feeling judged as well. So just super grateful for that Luxor space and the environment that we create and maintain in that space is paramount. I'm complete. Dr. B, please.
Respect,
Oh,
Brian.
hold on, real quick before you go, Dr. B.
Yeah.
I just want to just want to be conscious of the time. It's 2:45, and I want to make sure we have time for questions and also to hear the voices of the other artists who participated in
Sure.
the exhibit. So I just wanted to throw that out there real quick.
Yeah. So I'd aim to be swift. And authenticity was mentioned earlier. I being able to find a space where you can be your authentic self is difficult when you're living in America, and under the context of being Black and or indigenous, because you are most often forced to conform or do things that are not your norm, quote unquote. And to have those ciphers and circles with others that allow you to express yourself and express the woes or the stress that you might be dealing with, the successes that you are accomplishing, the perspectives that have come to your mind is invaluable. To share spaces with generations and those whom are older as well as younger than you allows you to gain perspective and insight real time to something that you might be reasoning through in the moment. And that's always appreciated. And it's also a requirement for all of us when we're talking about growing and developing as human beings. It's a requirement to have connections with those whom have come before you, and those whom will come after you, in order to properly be in the right context as you are experiencing life. Uh, I really resonate with what Sister Felicia has said about the consistency. I feel like this all starts with self. Baba Atum always spells self as CELLF, which is the collective energy living life fully. This is us bringing fully aware to the billions and trillions of cells that we are, the emotional, mental, physical, spiritual self that we are, the past, present, and future self that we are. All of these are contributing to our present reality and experience. And the more that we can tap into a consciousness of that, allows us to make better decisions that will help guide us in the direction that will lead to a more peaceful and productive life, in this, not in the terms of producing material wealth or anything like that, but producing joy, right? Producing feelings of satisfaction and success. Once again, earlier Baba O mentioned Mama Toni Morrison, and I would be remiss if I didn't share what came through my mind, because you mentioned the pieces that I am amazing, you know just art that she is, and we all are art in motion. And I remember her sharing, just the fervor to live outside of the white gaze, right? Which is being able to define your own context, not having the presupposition or the feeling like you've got to be or do something else, but just to be, period, right? Just to experience life as is extremely important to our mental health and well-being. And I appreciate her for sharing that type of consciousness, and may we all activate that type of consciousness, which is self-love. Loving self is as simple as taking in a deep breath and drinking clean water and eating food that is natural and pure. That's a practice of self-love. Being in tune with nature and feeling what sunlight feels like, feeling what the earth feels like. That's self-love. Um, and lastly, as we consider what is sacred, like spaces that we can create them to be sacred if we honor them in that way. I also want to return and give back agency to each and every one of you all here or in the future that may listen, to remember that you are a sacred being. You are a sacred entity. Your mind, body, and spirit is sacred, and you have full agency over your mind, body, and spirit. Let no one ever think or tell you that they know you better than you know you. You have the right to learn yourself in a way that no one can. And so practice patience with yourself, practice honesty, transparency, and truth with yourself, so that you may really be able to practice self-love and tune in to the sacredness that you are and will continue to emanate as you live this life experience, the more you tap in to self. And I rest, Baba O.
Thank you. Um, Luxor is the village, the male part of the village, but it's the village. And even though, as a social worker, I came to support those men who had lost their partners, uh, but it evolved into a village space where, even as an elder, I got just as much out of it as the younger brothers did. So it evolved into something that was just much more than the original intention, because it's multi-generational. Where can you go and have Black men having heart-to-heart conversations, intellectual conversations, multi-generational? It's very few places where that takes place. So we know we have to do everything we can to create more places like that. So funding is needed. In the chat, I put a chart where it talks about um, the polyvagal nerve. And at the bottom of the chart, it talks about social engagement. It's in that social engagement aspect where trauma gets released. So we know this happens when we meet, and we know that the men take that information and they use it with their families. They use it at work. They use it at school. They use it in the community. So we're really talking about a healing that has a wave upon wave upon waves that goes out. So the also in the chat is a document called the harm is to our genes. And COBRA is the National Coalition of Blacks for Reparations in America. And we did a study looking at epigenetics in terms of understanding the harm that's been passed down from generation to generation. But also what's beautiful about epigenetics, it gives us a science and a blueprint to project out further what we need to do to create the most healthy lifestyles for ourselves. So we can't divorce. Micro solutions is not going to solve macro problems. They're not. So as good and as beautiful as the Luxor is and what we do coming together, we must connect it because you have to look at the macro, the meso, and the micro. All those levels have to be together. And in our discussions, we speak about all of that. I'm complete.
Thank you, fellas. This was amazing. It was beautiful. I'm so glad that y'all were able to show up. I'm so glad that everybody's internet was good and smooth, so that it was clear. And just much appreciative. Again, like every time we have these type of sessions, I just feel so full, and feel very motivated, to keep making things happen. So with that said, if anybody in the audience has any questions or in the community has any questions that you want to ask, you want to share, get off mute, please. Let us
Greetings,
know.
everyone.
Yes, greetings.
Hi.
Greetings, everyone. I do apologize. I will not be able to bless you all too much longer with my presence visually on my face. So just know that I'm here for you all. I'm smiling. I'm showing up. And I really appreciate you, Dr. B, for inviting me to the space. I was just coming to support, but I appreciate you for saying my name. And I just wanted to say to you all, just everyone that's on the call, and I recognize there's a lot of elders on the call, and that is who I spend most of my time with in my life is elders and speaking to elders and learning and being at their feet. And I'm just ready for more. This is not enough. So I need to connect with you all, see if we can do any collaborations. We have events and workshops and meetings like this in Melanin Mothers Meet with a lot of intergenerational setups. And I would love to create something with you all this year, next year, or just something because this is what it's going to take, the conversations. Because we all experience so much and a lot of things are different. As men, you all experience, losing your wife or your lady or, losing your baby, maybe losing your son or whatever. And it's an issue and it's been an issue for quite some time. And the data shows that it's just getting worse. It's not getting better. And at this point, it's just like, it's irate. We all, should be, running around acting crazy because this is crazy, but understanding the strategic and the plan and what's televised and what's not is what's most important. And these are the kind of spaces that you can be your authentic self, like you said, and show up and, get to the solution. So I appreciate you all for putting this on. I do want to talk to whoever I need to talk to get information. If I can send my email via the chat, maybe, because it's serious and I'm ready to work. So let's go.
We appreciate that zeal and that fire, Mama Yada, and putting the onus on us to get motivated in action. We'll make sure to share, especially like Paul Week, which is coming up. We have some programming that you could definitely be a part of and active in. And then, of course, with the coordinators of this event. But we absolutely admire and appreciate that zeal and that fervor because we all should be irate. We all should be screaming from the rooftops with the types of statistics that we're talking about. There is a certain nonchalantness that is a part of this space in terms of maternal health and what's happening to Black women in particular and their children, our women, and that's something that we don't have patience for in terms of the brothers I know speaking in the room, and why we continue to be active in the way that we do is because we recognize we got to do something about it, and not just talk about it, but really be about that action. So,
And
and Baba
just
J, I see you shared Aftershock in the chat.
And
Amazing.
for those of you who haven't seen the film Aftershock on Hulu, please watch it with your family, with your community. It gives us a snapshot of this tragic situation we find ourselves in. And it's not even a crisis because it's been going on all the time, right? A crisis is talking about something that is different from the norm, from the average. This is just a continual aspect of what we call the Ba'afa. So please watch the film Aftershock. Thank you.
And real quick, Dr. B mentioned PAW, Postpartum Awareness Week. Just the dates for that, Omari? I can't remember off the top of my head.
Let's drop a link.
Yeah, I'm putting it in the chat now.
Okay.
It is. That's the link to our website. It's May 5th to May 10th.
Okay. Yep.
Yeah, so register.
Yes. I
Right.
think Felicia had her hand up.
Oh, I did. Yes. I just wanted to say that, thank you, fellas, for doing this and for showing up and being present. In all my 62 years, I don't think I have ever seen this much male presence anywhere that I have been discussing this very important situation with women, and it's not just a female thing. So thank you for being able to run the numbers, have the science, speak the language, because terminology, if you cannot speak the terminology, you get nowhere. You get no support, no focus. Thank you for being willing on this Sunday and for realizing that, it's not about the female being special. It's just about female being a human being that needs to be respected, just like the male entity as well. So I cannot thank you as males for showing up, especially on a Sunday. I know there's a game on too. But thank you very much. Thank you. And when I say thank you, I really, really mean thank you. Thank you.
Thank
And I
you.
want to help. I want to help. Are we meeting again next week? Just let me know.
Lot of energy.
Thank
But
Thank
the game means nothing when we
Not at
talk
all.
about being in this space. Yeah, so I don't know what game it is because I'm
Neither.
tuned in here.
No,
So I received that, especially on behalf of the collective, because we know our charge, and we know it's disheartening to hear that this is the most that you've seen in your lifetime, right? But it's also inspiring for us to make sure that we continue to do this work and continue just to grow the flame, and to ensure that we inspire generations to come of menfolk who truly accept the call of what it means to be a father, what it means to be a man, what it means to be an advocate for women. We are always going to teach them that you all are special, in particular, because without you, we do not exist. None of us, all of us here, have the mother that came before us, the father that came before us to give thanks. And without the woman's matrix, we would not be able to become who we are. It is you who bring us into being. And so we thank you for that. Whether you have birthed a child or not, your energy that is in the feminine and female form is paramount to our existence. So we really appreciate that in your energy.
Really quick, I just want to tell a quick story. When I first got into the maternal health data, I didn't really know what to do or how to do it, how to make any kind of change. And I remember it was like postpartum, no, it was maybe doula week or midwife week a few years back that I was hopping on Zoom calls, and I was trying to, figure out what I could tell women with the data that I had learned, how to make different moves or what to be aware of. I remember being on these calls with doulas and midwives and expecting moms, and I remember thinking to myself, like, this is a sacred space. And no matter how well-intentioned I am as a man, like, I felt uncomfortable. And that's when I started looking elsewhere to see how I can play my part, but not be in that space. And in doing research, I found Amari on Instagram, and he was painting women who had transitioned, and I reached out, and so our connection was made. But I tell that story because I feel like there are men out there that want to help, that don't know what to do. And I feel like if you guys as a collective ever encounter men or fathers that want to be a part of this change and want to be a part of this movement, point them into our direction, because at least this space can help garner the conversation and steer them in the right direction. And there's community here. So all that to say is that, you know, I didn't know where I was going at first, and then I found my tribe. This is the tribe. And if there are other men out there that are looking to make a difference in this space and they have nowhere to go, point them in our direction. And they'll have a tribe that can help them.
I would like to also add that there is a increased awareness and participation of men where now we are male doulos with an O. Usually doula was the A is feminine, doulo with the O is masculine. So there are men like myself who are training to become doulos. And the primary purpose is to, in fact, work with the men in the same way that the doula would work with the women. However, our training would allow us to work with the women and with the family. This is important because what is the goal? The goal is to create community midwifery. And what I mean by that is this. My daughter, who I adopted from Eritrea, she was telling me that her mother was a doula a midwife in Eritrea, but it wasn't just the women that would come and support that woman when she was having the baby. The village would come. The men would bring the wood. They would bring the food. They would bring anything that would make that environment wholesome and safe and joyful. The whole village would come. That's the goal. The goal is to create village midwifery. And the new Black model should include a midwife, a doula, a doulo, a lactation consultant, and a health coach. That team is what's missing. We have functions, we have people who assume those functions. They do that individually. And sometimes there is partnerships, but there is no collective that brings all of those entities together as one care team. That's what's missing. But we must understand that has been a consequence of oppression where our institutions have been demolished. We have to build them back up. That's the work in front of us.
Yes, Barbara. I'm gonna chime in on that because when I mentioned that telehealth and telesupport group earlier, I myself, I went to school, got a doctorate, but I also went and got the knowledge of what it meant to be a doula, what it meant to be a birth worker, what it meant to stand in that space and be a nurturer, to be an advocate, because it requires a very particular set of skills. And especially when you're dealing with menfolk, I really appreciate you, Brother Dre, for saying, there are men that want to be involved in this space but have no idea how to. They just can't even formulate in their mind, how do I go about finding others that can help me to be an advocate, or how do I go about doing what I need to do for the women that are in my life immediately. One thing that I'll say is please practice patience with these brothers. I'm working on a text now called Message to My Brother that is going to help, us speak to each other in a way that guides us towards collectives like Luxor, like Wellness Warriors, like these men cipher circles that hold men responsible for their actions and ensures that they accept the accountability within self to level up, right? To graduate into a different form that allows you to take responsibility and contribute to the change that is absolutely needed. So shout out to the Village Midwifery model, Baba O. I appreciate that.
Definitely.
I know we had 3, but Amari, we got AD who raised his hand, or her.
Okay.
Yeah,
We'll take another question and then we'll wrap. And also too, just want to, before we wrap, if you were in the exhibit, in the Art and Healing Advocacy Reproductive Justice exhibit, can you please raise your hand? Or if you would like to say anything about the exhibit. All right, awesome. All right, so after AD goes, we'll have Felicia speak and then we'll close.
Yes, peace. I am. Yeah, sorry, I'm mobile. Amari just sent me this information to join today. I joined last minute. I'm a filmmaker based in Brooklyn. I'm shooting tomorrow, so I'm running around a lot. So pardon not really being on camera often and my driving at the moment. But the documentary I'm shooting, before I speak on that, my involvement in this is I'm an uncle to 3 young, beautiful men, little boys. And during those birth processes with my sisters, I saw just the treatment they were getting and saw something was wrong. Then my stepmother had a C-section that went really bad, and I was fed up with it, and I had to find out what's going on, and I was open up to the world. That is what everyone is doing here with doulas and birth workers, and realize how big this is, and to the point that I think our brother Dr. V was making about not knowing what to do and how to get involved. I love sports, and I'm a filmmaker, so I decided to combine the two. I did a fundraiser in 2021 in the form of a baseball game, and it was to raise money for doulas and birth workers. I felt like that was the best way for me to contribute to what's going on. In that process, the men that showed up started having conversations about this, saying that, yeah, I don't know who to talk to about this stuff because I've been noticing the same thing that's going on. And the conversation started getting into the space of how it affects their mental health. And I thought, all right, I need to capture this. So that's the documentary I'm currently filming. We start shooting tomorrow. I'm based in Brooklyn. I would love to connect to any male doulas or Andre, you have data. I would love to connect with you. And if you know of anyone who does the same kind of work you do in New York, to get some interviews going, because I think these men want to talk about this. And I want to just explore the connection that this crisis is having on the mental well-being of, you know, all of us, but in particular Black men, because if they understand it better, then I believe they start getting more involved. Thank you guys so much for allowing me to speak and for the space that you guys have created.
Thank you, Adonis, for taking on this journey that you are on right now, shooting the movie tomorrow. That's awesome. And every step that you take, fundraisers, all that conversations, all that stuff counts. So I'll be sure to get your info, or maybe we'll drop our info in the chat or whatever. But we definitely have resources and people to connect you with that will help you on your journey. No problem.
Yes, much appreciated, brother. And don't limit yourself to New York, man. Everything, we got virtual platforms you can use now too. So if you need somebody, you know, we will help you out so you get into contact with them.
100%. Yes, sir.
1,000.
Sandra has her hand raised. Hi, Sandra.
Thank you all so much for this conversation. I actually have a piece in the exhibit at this time, and I chose to focus on the fertility aspect of it and how, as women, you know, we're born with the number of eggs that we're going to have, and making sure that we are nurtured from the very beginning as a young girl, adolescent, into womanhood before we actually get pregnant. And so sometimes that's the conversation that doesn't happen as well, in terms of making sure that we're surrounded by the right type of role models, whether that's the aunts and the grandmothers and the moms and, you know, your community. And so I just wanted to share that this was very dear to me to participate, and I'm loving this conversation we have around the guys. Being married for a little over 40 years, I was treated like a princess for both of my pregnancies. And I know the importance of being treated like that queen that you are, and how that outcome not only nurtures you through the pregnancy, but as those kids grow. As I've got two amazing adult sons that I talk about all the time. And I know part of that was because my husband took the time to make sure that I was nurtured. And I just wanted to share that. So thank you.
Thank you. Thank you. Thank you. Thank you. You know, grief was mentioned earlier, and, you know, with you talking about infertility, we don't talk about that. We act like, you know, people can just get pregnant whenever they have sex with each other, and that's not always the case. Especially within our community, there's this idea that, you know, infertility doesn't exist, or is not as big of an issue as it is, and I really resonate with that. I'm looking forward to being able to view and see your work, and I think that men and women, especially in this community, have to really recognize how important it is for those community supports. Like Baba O said about the village midwifery, and you said about being treated like a princess. When you have those lack of supports around you, it really can turn into infertility, as well as lead to issues with the children and with the parents that are involved. And so I really want to advocate for that and help continue to support families. But thank you for mentioning that.
Awesome. We have Betty with her hands up. Hey, Betty.
Thank you for this. It is so critical. And I also want to make sure that I keep you connected with you all, because there are other avenues that really need to hear from men. My question is, this is vital work for adult men or young men. And I'm concerned about boys because they get imprinted so young with behaviors that are not life affirming. Have there been any ideas within Luxor about how to work with boys, or how to connect with organizations that are working with boys for behavior, supporting healthy behaviors so that they can become healthy partners and fathers? And I'm complete.
Yeah, that's a great question, Betty. Right now it's in the works. We're working with Ariah just was able to get a group of interns this year in order to work on different parts of events, programmings that we have for the organization. These interns are all in grad school and like medical school, so like college level interns. But we've been in conversations with youth organizations as well, and we do a lot of work with youth organizations in our events and our conferences. So also there's this organization, for instance, called Theo. Theo stands for oh my gosh, I can't remember right this second, but
Okay.
they are a group of young high school students who are in this um, um, performance art and also, you know, physical like enlightenment space, so that, you know, we work with them closely. But to answer your like specifically answer your question, you know, there's something that we would love to do. I think that between and the conversations that we have, you know, we want to make sure that we're having these conversations, like you said, with, you know, middle school children, high school children, because these are the men, boys, and young girls who are going to be bringing new life into the world. We're pretty much done at this point, you know, but it's important that others get information so that they know exactly what they're facing with, you know, when it's when their time comes.
Right.
But you know, it's something that me, Andre, Baba J, Dr. B will be looking into in terms of how we can specifically get young men and boys in here. But we do also have men who come to the Luxor Collective who have their own youth organizations.
Okay.
So it's essentially just a conversation, honestly, and figuring out ways that we can create some collaboration and some partnership around it. Yeah,
Great. Thank you for what you're doing.
no problem.
Mama Yata.
Greetings. Yes. Back to I think it was we're talking about the fertility. I just wanted to mention for the flyer that I put in the chat, and I hope that was okay. The Black Maternal Health Exchange, I put it right before, sorry, right before the Black Maternal Health Week, which we are recognized for in our city proclamations with the mayor. And what we want to do is the speakers that we have, one of the speakers, she's had 8 miscarriages and 1 stillbirth, and she finally had her baby. And so now her business reflects helping moms in that grieving space, in that space where postpartum shifts, but it never goes away. And yeah, so I just want to invite you all there, and hopefully again we can collaborate. I think I did put my phone number there. Shoot me a text, or you know, I just really would love to again reiterate the importance of collaboration and, you know, getting started immediately. And I appreciate you all for this space to be able to even say this in. So thanks again, Dr. B, for this connection.
No doubt.
Thank you, Mama. Yeah.
So we have Baba J, and then
To close out. I want to make sure we're mindful of everybody's time. It's now 3:15. Go ahead,
Thank
Bobby.
you. Thank you. So the goal of the community or village midwifery is to have every Black woman that delivers 9 days of doing nothing. Not at least starting with 9. Of course, it should be more than that, but let's start with 9. If you can't do 9, do 6. if you can't do 6, do 3, but at least, but the only way that can happen, the village has to come into existence.
Mm-hmm.
So we can't just, we have, what I'm trying to say is that we have to do these things, but we have to also organize. We have to organize. We have to organize the people, the thoughts, the materials, the artists together in such a fashion that when that woman has that baby, she does nothing for 3, 6, for 9 days. And then that group stays together to say, well, who's next? So I just want to leave us with that as the charge. 9 days, people. Let us make it so that any Black woman having a child, 9 days, she does do nothing except love herself and her baby. That's it. I'm complete.
Ashe. Thank you much, Baba J. So with that said, one, love yourself, right? And also we got to make sure that we love our babies and honestly create these spaces where we're that's what I'm looking for, where we're proactively, creating these spaces to make this type of thing happen. Because everything sounds great, and anonymity and logic, but like it takes time, energy, and effort more than anything to make these things happen. So, conversations like this are part of that piece of push our movements forward. But I just want to say thank you, Prudence. Thank you, Cynthia, again for creating this space for us. Thank you for allowing us to share our energy with your community. And thank you for people on our ends, who came up and showed out and gave us an opportunity to connect all of this, right? And this is all so important because it is all rooted in art. We are, like Dr. B said, we all are moving pieces, right? Moving artwork, and it's important that we engage and from an artist perspective, being able to have these conversations to stimulate ideas, stimulate what's going to be next for us, and that this is how it happens. I know that from again an artistic perspective, art is also a revolutionary act. I know that it's gone for me from just trying to create cool stuff to creating things with a purpose, and a vision and a statement and something that says something and can speak to people and move people, and I hope that this experience today gave everybody that type of vigor, that type of energy, that type of want, to get up and pick up whatever the medium that you use, whether it's paint or, clay or wood or whatever it is, fabric, whatever it is that you use to create, data, computer, typewriters. People don't use typewriters anymore. Keyboard, excuse me. But whatever it is that you use, So again, thank you, and I hope that we can do this again. And again, I want to reiterate, please, if you have not seen the exhibit, it is at Artists and Makers in Rockville, Maryland. It will be there until March 26th. Please check it out. And I will definitely be down there. When I get down there, I will definitely be hitting you up, Prudence. I will definitely be hitting you up, Cynthia. So again, thank you again, ladies.
Thank you.
Thank you. Thank you.
Right. And hope
Thank you so much.
a blessed day.
Thanks,
Thank
everyone.
you.
Yes, thank you. Thank you so much. Thank you. Thank you.
Thanks.
Bye.
Bye-bye.
Bye-bye.
Continued success.
Thank you.
Continued success indeed. Thank you.
And
There's
please
never enough time.
share all the links that are in the chat. Mama Yada sent a bunch of stuff in the chat. I also sent a bunch of stuff in the chat about Speak Move Change and our next event coming up in May
Share and
and
repost.
also in April. Yeah, so please share, please repost, please hit those QR codes. All right.
Do.
All right. Great one.
Thank you all so
Thank
much.
you.
Bye.
Bye.